Welcome. Today, Antolin, David, Jamie, Emily, and Lisa will be discussing emphysema. Emphysema falls under chronic obstructive pulmonary diseases along with bronchitis and asthma. Emphysema involves the respiratory system in which the lungs ultimately break down and lose their elasticity due to improper airflow from a restricted pulmonary artery. In this chart recorded by the CDC, it shows the age distribution between COPD victims over 18. Results are clearly predicted that age is a risk factor, with the majority being above age 45. Here we see the prevalence rates of COPD over 18 years of age. It is evident that income and racial backgrounds are large factors perpetuating emphysema. The exact cause of emphysema is unknown, but is strongly associated to cigarette smoking. Even so, not all smokers will develop emphysema, suggesting a genetic factor such as those with a condition that renders them deficient in alpha-1 or AAT, a protein in the blood that allows the white blood cells to fight infections but not damage other tissues. Living in areas with poor air quality, long-term exposure to chemicals, and chronic bronchitis are other possible causes. As the fragile tissues between air sacs are destroyed by toxins such as cigarette smoke, air pockets in the lungs develop, allowing air to become trapped in these spaces of damaged lung tissue, causing the lungs to gradually enlarge. This results in a more time and effort for the lungs to be emptied. This process occurs slowly over years. In preliminary diagnostics for emphysema, a stethoscope can be used to listen to breathing to detect abnormal respiratory sounds, because chest X-rays are not as effective in diagnosing emphysema in its early stages. The most significant diagnostic test is the spirometry test, which measures the movement of air in and out of the lungs. A physical exam could show the characteristic barrel chest during later stages. There are a variety of treatments for emphysema. One treatment option is medication use. Medications such as bronchodilators, steroids, antibiotics, and vaccines help in treating emphysema. Bronchodilators can be inhaled as aerosol sprays or taken orally. Bronchodilator medications may help to relieve symptoms of emphysema by relaxing and opening the air passages in the lungs. Steroids can also be inhaled as an aerosol spray. Steroids can help relieve symptoms of emphysema associated with asthma and bronchitis. Antibiotics help by fighting respiratory infections common in people with emphysema, such as acute bronchitis, pneumonia, and the flu. Getting vaccines to prevent infections such as the flu or pneumonia can help patients with emphysema by reducing their chances of complications. Preventions. Do not smoke, and if you do, quit smoking. This can prevent or slow the progression of emphysema. Limit your exposure to air pollution if possible, and wear a respirator mask if you're exposed to harmful chemicals at work. For those already suffering from emphysema, it is important to stay vaccinated. Vaccinations against influenza and pneumonia can help to prevent life-threatening respiratory infections in people with lung disease. Medications such as bronchodilators, corticosteroids, and antibiotics prescribed by a doctor may be taken to control symptoms of emphysema. Rehabilitation, surgery, and even transplants are sometimes necessary to keep emphysema under control in more advanced stages of the disease. Better surveillance is needed to map the magnitude of chronic respiratory diseases and analyze their determinants, mainly with reference to poor or disadvantaged populations, and to monitor future trends. Primary prevention objectives are to reduce the level of exposure of individuals and populations to common risk factors such as tobacco, poor nutrition, frequent lower respiratory infections during childhood, and environmental air pollution. Secondary and tertiary prevention are to strengthen health care for people with chronic respiratory diseases by identifying cost-effective interventions, upgrading standards and accessibility of care at different levels of the healthcare system. Reduce activity limitations among adults with chronic obstructive pulmonary disease. Reduce deaths from COPD disease among adults. Reduce hospitalizations for chronic COPD disease, and reduce emergency department visits for COPD disease.